So the first place that we can have things going on, just like we talked about in your cervical spine, you can have issues at your lumbar spine, and they're very similar to what we have in the cervical spine, right? We can have degeneration, wear and tear, overuse, and again, disc issues, herniated disc, bulging disc. So in your lumbar spine, here is your vertebra, here's the discs in between, and then here's the nerve roots that come out at each level. So let's say we have overuse, wear and tear, or perhaps a significant one-time injury. You lift something, you pull, you can have what's called a herniation, again, or a bulge. So if I pause this video right here, this outer ring hasn't ruptured yet. That's a bulging disc. That just means this little bit that's bulging out is going to push and pinch on this nerve root, but the inside of the jelly donut hasn't ruptured yet. So that's the difference between a bulging disc and a herniated disc. The bulge is just the pushing of the inside of the disc material out onto a nerve root. And then a herniated disc is when it actually ruptures and the stuff ruptures out the inside. So, but this is a nice illustration. It kind of shows how the pinching of the nerve up high, remember that these nerves travel all the way down through your glutes, all the way down to the bottom of your feet. So you can have radiating symptoms, pain, numbness, tingling, all the way down the length of your leg. So it could be just into your upper glute. It could be all the way down into the back of your knee, down into your calf, to your foot, to your ankle. So just know that when you have something going on, this is kind of place number one, right? Maybe it's coming from your back. And like I said, you can have a rotation of one of these vertebrae that can get pulled just simply because the muscles go into spasm. So if some of these muscles freak out, they can pull a vertebra out of place, which can then pinch on a nerve. So herniated disc, bulging disc, pinched nerve, those are issues that are typically happening more from your lumbar spine.